Certified Registered Nurse Anesthetists, CRNAs, are advanced practice nurses who administer anesthesia and monitor patients before, during, and after surgical, obstetrical, and diagnostic procedures. In part 1 of this video series, we explore 25 General Certified Registered Nurse Anesthetists, CRNA, interview questions and answers. Each answer can be customized to highlight your unique qualifications and experiences. Before your interview, be sure to research the company and review the job description so you can include key skills relevant to the job role in your answers. Don't forget to watch part 2, where we cover 20 clinical CRNA interview questions. I have posted the link in the description below. Question number 1. Can you tell me about yourself? This is often the opening question because it sets the tone for the rest of the interview. Hiring managers want to hear a summary that's relevant to the role, not your entire life story. For CRNA candidates, they're looking for a sense of your clinical background, your communication skills, and how well you understand the responsibilities of the role. They also want to gauge your confidence and professionalism in how you present yourself. If you have previous experience working as a certified registered nurse anesthetist, you can use the following answer in your interview. Sure, I'm a certified registered nurse anesthetist with 5 years of experience providing anesthesia in both hospital and outpatient settings. I began my nursing career in the ICU, where I developed a strong foundation in critical care and patient advocacy. After completing my anesthesia training, I worked in a level 1 trauma center where I've handled everything from high-risk obstetrics to orthopedic and cardiac cases. I really enjoy the autonomy of the CRNA role and the constant need to stay sharp, whether it's making real-time decisions during induction or helping patients feel calm pre-op. What drives me most is providing safe, individualized care and building strong communication with both patients and the surgical team. I'm now looking to join a practice where I can keep growing clinically while being part of a supportive, high-performing team. Next, here's a perfect answer for someone with limited experience as a certified registered nurse anesthetist. Sure, I'm currently finishing my CRNA training and come from a background in critical care nursing with over 3 years of ICU experience. During that time, I managed complex ventilator patients, worked closely with anesthesiologists, and became confident with titrating drips, managing sedation, and responding to emergencies. That experience motivated me to pursue nurse anesthesia. It gave me a first-hand look at the impact CRNAs have on patient outcomes and safety. In my clinical rotations, I've worked in a variety of settings, including general surgery, OB, and trauma. I've found that I thrive in high-pressure environments and really value the precision and focus that anesthesia requires. I'm passionate about the field and excited to start my CRNA career in a setting where I can keep learning, stay challenged, and contribute to a strong anesthesia team. Question number 2. Why do you want to become a CRNA? This question helps hiring managers understand your motivation and long-term goals. They're looking for passion for the field, a clear understanding of the role, and a sense that you're committed to patient care and lifelong learning. It also gives insight into how much thought you've put into pursuing a high-responsibility career. I want to become a CRNA because I'm drawn to the combination of clinical precision and personal responsibility that the role carries. From my experience in critical care, I've seen how crucial anesthesia is to safe outcomes and how valuable it is to have a provider who can think clearly, act quickly, and anticipate complications before they arise. I enjoy procedures, I enjoy autonomy, and I thrive under pressure. But more than anything, I want to be part of the team that makes patients feel safe during some of their most vulnerable moments. As a CRNA, I'd be able to use both my technical skills and my ability to read a room, build trust, and stay calm. The more I've learned about the profession through shadowing and working closely with CRNAs, the more I've felt like it's the right fit for how I think and how I work. I'm excited about the path ahead, both for what I'll contribute and what I'll continue learning. Question number 3. What kind of patients do you take care of? What's your favorite and why? Hiring managers want to assess your clinical background and comfort level with different patient populations. Your answer gives them a sense of your preferences, where you thrive, and how well your experience aligns with anesthesia care. They also want to see emotional insight, not just technical details. I've worked mostly in a high acuity cardiac ICU, so I've cared for patients with heart failure, post-op TABGs, ECMO, and those awaiting or recovering from transplants. I've also floated to surgical ICU and neuro ICU, giving me a solid range of experience. My favorite patients to care for are those post-cardiac surgery, especially within that first 24-hour window. I love how detail-oriented it is. You have to manage pressors, anticipate rhythm changes, balance fluids, and work closely with every team member. It's intense, but incredibly rewarding. What I enjoy most is being hands-on and having to make real-time decisions that directly impact stability and outcomes. That's what drew me to anesthesia too. It's about seeing the whole picture, predicting what could go wrong, and staying several steps ahead. These patients really push me to grow as a nurse and deepen my desire to pursue anesthesia. Question number 4. Tell us about a typical patient. What drips would they be on? This question tests your clinical knowledge and attention to detail. They want to see if you're familiar with critical care pharmacology and how comfortable you are managing complex patients. Your ability to describe a typical patient shows how well prepared you are for the hands-on demands of a CRNA program. A typical patient in my cardiac ICU would be someone post-CABG or post-valve replacement. In the first 24 hours, they're often on multiple drips. I've commonly managed patients on norepinephrine, vasopressin, sometimes epinephrine depending on the case, and usually insulin infusions to maintain tight glucose control. We'd also use fentanyl or dexmedetomidine for sedation, and sometimes milrinone or dobutamine if they had right-sided heart strain or poor contractility. If volume status was an issue, I'd be titrating based on CVP, SCVO2, or bedside echo findings. In terms of monitoring, I'm used to working with arterial lines, central lines, and temporary pacing wires. I chart closely on vitals, urine output, and response to titrations, and I always communicate changes promptly with the team. Understanding how all these pieces connect has prepared me well for the next step in my career. Question number 5. Tell me about your work experience. They want to get a full picture of your clinical background, including the level of acuity, types of patients, and your role in the team. This helps them understand how prepared you are for the academic and clinical rigor of CRNA training. It also gives them insight into your progression and work ethic. I've been a registered nurse for a little over 4 years, all in critical care. I started in a step-down unit, but moved into a cardiac ICU within my first year, where I've now worked for the last 3 years. We manage a wide range of patients: CABGs, valve repairs, heart transplants, ECMO, and ventricular assist devices. My role includes managing multiple drips, interpreting complex monitoring, assisting with bedside procedures, and acting as a preceptor to newer nurses. I'm comfortable working with central lines, arterial lines, ventilators, and collaborating with multidisciplinary teams. I've also been involved in unit-based initiatives to improve sedation practices and reduce ventilator-associated events. What I enjoy most is being in situations that require quick thinking and collaboration. Working in that kind of high-stakes environment made me realize how much I value being in control of dynamic situations, which is one of the many reasons I was drawn to becoming a CRNA. Question number 6. How do you describe success? They're looking for self-awareness and insight into what motivates you. Your definition of success reveals your values, how you measure progress, and what kind of professional you strive to be. It also helps them see whether your mindset fits with the demands of anesthesia practice. I believe success means staying calm under pressure and doing the right thing, even when it's uncomfortable or difficult. It's not about being perfect, but about being dependable, especially when someone else's life is in your hands. As a nurse, I feel successful when a patient leaves the unit in better condition than they came in, and I know I played a part in that. It also means communicating well with the team, being open to feedback, and staying committed to growth. Looking ahead to being a CRNA, I think success will come from continuing to make sound decisions under pressure, staying current with evidence-based practice, and always treating patients and families with respect. Success isn't just clinical skill, it's how you show up when things get tough. Question number 7. What does a CRNA do? They want to confirm that you truly understand the CRNA role. It's not just about tasks, it's about autonomy, responsibility, and patient-centered care. Your answer should show you know what's expected on a clinical and professional level. A CRNA is responsible for delivering safe and effective anesthesia care across a range of settings, whether that's in the OR, ICU, OB, or outpatient. They assess patients preoperatively, develop anesthetic plans, administer induction agents and maintenance drugs, monitor vital signs and depth of anesthesia throughout the procedure, and manage recovery. What sets CRNAs apart is their autonomy. They're often the sole anesthesia provider in rural or underserved areas, which means they have to be confident in both decision-making and problem-solving. CRNAs also play a huge role in airway management, regional anesthesia, and responding to emergencies. But it's more than just clinical care. A CRNA also needs to build trust quickly, especially when patients are anxious or vulnerable. Communication, compassion, and attention to detail are just as important as technical skill. That mix of independence, pressure, and human connection is what makes the role so meaningful to me. Question number 8. How do you think your role in the ICU relates to the role and responsibilities of a CRNA? This question helps the interview panel understand how well you grasp the transition from ICU nurse to anesthesia provider. They want to see if you can connect your critical care experience, like rapid assessments, patient advocacy, and managing complex medications, to the CRNA role. It's also a way to gauge your readiness for anesthesia training. In the ICU, I've learned to manage unstable patients, think clearly under pressure, and communicate clearly with multidisciplinary teams. All of those skills carry directly into the CRNA role. For example, titrating vasoactive drips and interpreting hemodynamic data in real time has given me a solid foundation for understanding anesthesia management. I've also developed a strong respect for anticipating patient needs rather than just reacting. Whether it's noticing early signs of deterioration or advocating for a needed intervention, those habits are critical in the OR, where seconds matter. One of the biggest overlaps is the importance of precision and vigilance. In the ICU, we're taught to double-check everything, to know the patient's story, labs, and meds before making a move. That attention to detail is something I carry with me and would apply fully in the anesthesia setting. Question number 9. What would make you a successful CRNA? This question reveals your self-awareness, drive, and understanding of the profession. The panel is looking for evidence that you're not just academically capable, but emotionally grounded and motivated by the right reasons. It also gives insight into your work ethic and interpersonal style. I think what would make me a successful CRNA is my commitment to being both clinically sharp and emotionally steady. I've always been someone who stays calm under pressure, whether I'm responding to a code or navigating a tough conversation with a family. I also don't cut corners. If I'm not 100% sure about something, I'll double check or ask. That mindset, combined with my experience working closely with intensivists and anesthesiologists, has helped me develop a strong clinical foundation. I truly enjoy learning, and I know CRNA school is intense. But I'm drawn to the challenge because I know I'll be better for it. I believe being a great CRNA means blending technical expertise with human connection, and that's where I see myself thriving. Before we continue, I just want to take a moment to thank you for watching this video. You can download a copy of these interview questions and answers in PDF format by clicking on the link below and supporting my channel by making a minimum donation of $3. Your support allows me to keep creating valuable content to help you pass your interview and land your dream job. Thanks for your support and appreciation. Question number 10. Do you foresee any barriers to your education? They want to know how prepared you are, mentally, emotionally, and logistically, for the rigor of CRNA school. This question helps assess your self-awareness, planning, and resilience. They're also gauging your support system and how you'll manage the workload. I know CRNA school will be intense, and I've thought a lot about how to set myself up for success. Right now, I've taken steps to reduce my financial stress. I've saved, budgeted, and talked to a financial advisor about how to manage loans responsibly. Time-wise, I've also spoken with my family and close friends about what the next few years will look like. I've made sure I have a solid support system in place that understands my focus will need to shift. The biggest challenge might be adjusting to a full-time academic workload again, but I've already started brushing up on advanced physiology and pharmacology to prepare myself. I'm not walking into this with rose-colored glasses. I know it'll be tough, but I'm ready and willing to do the work. Question number 11. Tell me about a time when you had an ethical dilemma at work. What did you do? This question helps the panel understand how you handle complex situations where your values may be tested. CRNAs are often in high-stakes environments where ethical decision-making matters. They're looking for integrity, sound judgment, and the ability to advocate for patient safety. There was a time in the ICU when a provider ordered an aggressive treatment for a patient who was clearly end of life. The patient was full code, but the family had been asking about comfort care and didn't fully understand the situation. I felt torn. My job was to follow orders, but I also felt the family hadn't been properly informed. I calmly spoke with the charge nurse and requested an ethics consult. I also asked the attending if we could pause and have a family meeting before proceeding. The conversation ended up being very productive, and the plan of care shifted to focus on comfort. It was a tough call, but I felt I had a responsibility to advocate. It reminded me that doing what's right for the patient sometimes means speaking up, even when it's uncomfortable. Question number 12. What are your strengths and what are your weaknesses? This question is about self-awareness. Interviewers want to see if you know how to leverage your strengths and work on your growth areas. It's also a chance to show humility without losing confidence. One of my strengths is staying calm in high-pressure situations. I've been in codes, emergencies, and rapid changes in patient status, and I've learned how to keep my focus, communicate clearly, and act fast. I'm also very thorough. I like to know the full story and triple-check my meds, which I think is essential for anesthesia. As for weaknesses, I used to have trouble asking for help. I felt like I needed to do everything on my own to prove I was competent. Over time, I've learned that asking questions or asking for support doesn't make me weaker. It actually helps patients more. I've worked on being more collaborative and speaking up sooner when I need clarity or guidance. Question number 13. Tell me one of your greatest accomplishments. This gives insight into what you're most proud of and what kind of impact you aim to make. They want to see your passion, initiative, and follow through, things that are essential in a CRNA role. One of my greatest accomplishments was helping develop a new protocol for post-cardiac arrest care in our ICU. We were seeing inconsistent practices across shifts, which affected patient outcomes. I collaborated with our nurse educator and physicians to review evidence-based guidelines and help draft a clearer step-by-step process. I also led a few in-services for nurses on the changes. It wasn't easy. Getting buy-in from everyone took time, but within a couple of months, we saw better communication and more consistent implementation. It felt good to be part of something that improved care beyond my own shift. That experience made me realize I enjoy taking initiative when I see a gap, and it's something I'll carry with me into the CRNA role. Question number 14. Give me an example of when you showed leadership and teamwork. CRNAs work independently, but are also part of a tight-knit team. This question helps assess whether you know how to take initiative while also supporting others. They're looking for strong communicators who can lead by example. During one of our busiest shifts, we had 3 new ICU admissions back-to-back. I stepped up to help coordinate who was going where, made sure our less experienced nurses felt supported, and took on the most unstable patient myself. I also kept open communication with the physicians and made sure we were prioritizing labs and imaging. That day wasn't about titles. It was about stepping in where needed, staying calm, and keeping the team focused. Everyone worked hard, but I think being proactive and communicating clearly helped prevent things from spiraling. I've also led unit-based projects like our sepsis protocol refresher, where I organized team huddles and worked with different roles across the floor. Those moments taught me that leadership isn't about doing it all, it's about helping the team succeed together. Question number 15. Give an example of community service. CRNA programs often value candidates who give back. Community service shows compassion, initiative, and a commitment to others beyond the hospital. It also highlights how well-rounded you are. Over the past year, I've volunteered at a local health outreach program that provides free BP checks and health screenings for underserved communities. Once a month, I help set up the clinic, take vitals, and provide basic education on managing chronic conditions like hypertension and diabetes. One experience that stuck with me was helping an elderly woman understand her new medication. She'd been taking it incorrectly due to language barriers. We worked with a translator and printed out a simple schedule for her to follow. That moment reminded me how much of a difference clear communication can make. Volunteering has kept me grounded and reminded me why I got into nursing in the first place, to help people feel safe, heard, and cared for. Question number 16. Give an example of problem solving. Hiring managers ask this to assess your ability to think critically, especially under pressure. As a CRNA, problem solving often happens in real time during procedures. They want to know how you approach issues methodically, communicate with the team, and make decisions that prioritize patient safety. During a case with a morbidly obese patient scheduled for laparoscopic cholecystectomy, I noticed early signs of difficult ventilation after induction. The airway pressures were climbing, and despite pre-oxygenation, the SpO2 started dropping. I quickly asked for repositioning aids, elevated the head of the bed, and transitioned to a two-handed mask ventilation technique with an oral airway. I also requested video laryngoscopy, which gave us a clearer view, and we successfully intubated on the second attempt. Throughout, I communicated with the surgeon about the delay and kept my team in the loop. After the case, I documented the difficulty and debriefed with my attending to review what went well and what could be improved. It was a reminder of how quickly things can change and how staying calm, working through the options, and leaning on your training helps avoid complications. Being proactive and prepared can turn a potentially risky situation into a successful one. Question number 17. What would your colleagues say about you? This question gives insight into your teamwork, reliability, and how others perceive your professionalism. CRNAs work closely with nurses, surgeons, and other anesthesia providers. Hiring managers want to hear how you contribute to the environment and whether you're someone others trust. I think my colleagues would say I'm dependable, calm under pressure, and always willing to help. I've been told that I bring a steady presence to the OR, especially during tense or complex cases. Whether it's staying late to assist with a backup, stepping in to help prep a room, or just listening when someone needs to talk after a tough shift, I try to be supportive. People know they can count on me to do my part and to speak up if I see something that could affect patient safety. I don't take shortcuts, and I treat every case, big or small, with the same level of care. I also think they'd say I'm easy to work with. I communicate clearly, I'm open to feedback, and I know that teamwork is what keeps things running smoothly. Nobody does this job alone. Question number 18. How do you handle stress? CRNA roles come with intense pressure, long hours, split-second decisions, and responsibility for patient lives. Hiring managers ask this to understand how you maintain composure, avoid burnout, and continue performing effectively when things get tough. I handle stress by staying grounded in what I can control and preparing as much as possible before the day begins. Before every shift, I arrive early to review cases, double-check my setup, and give myself a quiet moment to mentally focus. That routine helps set the tone for the day. In the OR, if things start to escalate, I rely on clear communication, deep breathing, and focusing on one step at a time. I've learned that staying calm not only helps me think clearly, but it also helps the entire room stay steady. Outside of work, I stay active and spend time with people who help me recharge. My support system is a big part of keeping balance. I'm also good at recognizing when I need to take a moment to regroup or talk something through with a colleague. Stress is part of the job, but I've built habits that help me manage it without letting it affect patient care or my long-term health. Question number 19. Tell me about a time when you were working with someone who had a different value system than yours. How did you deal with this person? This question explores your emotional intelligence and ability to maintain professionalism when values don't align. CRNAs work in high-stakes environments with many personalities. Hiring managers want to know if you can focus on patient care while navigating potential conflict or ethical tension. During one rotation, I worked with a surgeon who had a very authoritative style and often dismissed input from the anesthesia team. It didn't sit right with me, especially when patient safety could be affected. I knew pushing back aggressively wouldn't help, so I took a calm approach. I focused on presenting facts and keeping the conversation centered around patient outcomes. For example, during a case where the surgeon wanted to proceed despite low blood pressure, I clearly explained the risks and backed it up with clinical reasoning. I also made sure to document everything appropriately. Over time, our working relationship improved because I stayed professional and consistent. I didn't try to change the person. I focused on doing my job the right way. It taught me that you can't control how others act, but you can control your tone, your boundaries, and your focus on patient care. That's what matters most. Question number 20. Tell me about a time when you felt that you were right and everyone else was wrong. What did you do? Hiring managers use this to evaluate your humility, communication, and decision-making when your opinion goes against the majority. In anesthesia, advocating for the patient sometimes means going against the grain. They want to know you'll speak up appropriately and back it up with knowledge. During a case pre-op assessment, I noticed a patient had a borderline low potassium level that everyone else seemed to brush off. The team wanted to proceed without delay, but I wasn't comfortable moving forward without addressing it. I brought it up again, explaining the potential risk of arrhythmias under anesthesia and cited the latest protocol guidelines. While there was some pushback, I stayed respectful but firm, and I offered to take responsibility for getting labs rechecked and starting replacement therapy. The second result confirmed my concern. Levels had dropped further. We ended up correcting the issue before surgery, and the patient did well. Afterward, the attending thanked me for speaking up. That moment reminded me that advocating for the patient, even if it's unpopular, is part of the job. It's not about being right for the sake of it. It's about doing what's safe and using your training to support your decision. Question number 21. Where do you see yourself in 5 years? This question helps the panel understand your long-term commitment to the profession and how you view your role within the healthcare system. They want to see if you've thought seriously about your career path, including how you plan to grow after completing a rigorous program. Your answer shows whether you have realistic expectations and if you're goal-oriented in a way that aligns with the CRNA profession. In 5 years, I see myself working as a confident and competent CRNA in a hospital setting, preferably in a team-based anesthesia care model. I hope to be in a role where I'm trusted to manage complex cases independently, but also collaborate with surgeons, anesthesiologists, and nurses. I'm passionate about critical care and want to apply that background to provide safe, patient-centered anesthesia. At the same time, I'd love to mentor future students or new grads entering the field. I've benefited so much from supportive preceptors and mentors, and I want to be someone who gives that back. Long-term, I'm open to leadership or teaching roles if the opportunity arises, but my primary focus in the next 5 years is to master the clinical side and continue learning every day. I see CRNA as not just a job, but a responsibility that requires lifelong growth. Question number 22. Why did you choose to apply to our program? Have you applied elsewhere? Programs want to know if you've done your research and if you're truly interested in what they offer. This question helps them understand how you evaluate your options and whether your values align with their mission. They also want to hear if you're being transparent about applying elsewhere, which is normal and expected. I applied to your program because of the strong clinical experience, the high board pass rate, and the reputation your faculty has for being supportive but rigorous. I spoke with 2 alumni who told me how much the program pushed them, but also how much they felt seen and supported through the process. That balance really matters to me. Your focus on simulation, access to a wide range of clinical sites, and smaller class size were all things that stood out. I want to be challenged, but I also want to build close relationships with my peers and instructors. I have applied to 2 other programs, mainly for geographic reasons, but this program is my top choice. I'd be proud to train here and know it would prepare me well for the responsibility that comes with being a CRNA. Question number 23. If you saw one of your fellow students or colleagues using drugs or cheating, what would you do? This question tests your ethics, professionalism, and courage. Programs and employers need to know that you'll prioritize patient safety and integrity, even if it means making an uncomfortable decision. They want to hear that you understand the seriousness of the role and the importance of accountability in high-stakes environments. If I saw someone using drugs or cheating, I'd have to speak up. As uncomfortable as that might be, patient safety has to come first. There's no room for guessing or hoping someone gets better on their own. I would report it through the proper channels, whether that's a faculty member, clinical supervisor, or the program director. That said, I'd approach it from a place of concern, not judgment. People struggle for all kinds of reasons, and I believe in helping someone get the support they need. But when it comes to clinical responsibility or academic honesty, the stakes are too high to ignore. It's part of being a safe provider, knowing when to speak up and do the hard thing, even when it's uncomfortable. I would hope someone would do the same if it were me who needed help. Question number 24. How do you feel about giving up a paying job for several years? CRNA programs are demanding and often require students to leave well-paying roles. Interviewers want to know if you've seriously considered this trade-off and if you're mentally and financially prepared for the sacrifice. They want to be sure you're making the decision with full awareness and commitment. I've definitely thought about the financial sacrifice, and I'm prepared for it. Before applying, I spent over a year saving, budgeting, and talking to CRNAs and former students about what to expect. I know I'll have to give up the comfort of a steady paycheck, but I see it as an investment in something much bigger. I'm not choosing CRNA school lightly. I'm choosing it because I believe in the long-term value of the work. I've worked hard in critical care, but I'm ready to go deeper and have more responsibility in patient outcomes. This career will let me practice independently, provide top-level care, and have a lasting impact. So yes, it's a few tough years up front, but I'm ready for it. I've lived on less before, and I've built a support system that understands what I'm committing to. And finally, here's the last question. Question number 25. Describe any activities or courses you have taken to help prepare you for CRNA school. This question helps the panel see how proactive you are in preparing for the program's academic and clinical demands. They want to know that you understand the intensity of CRNA school and have taken real steps to be ready for it, academically, emotionally, and professionally. To prepare for CRNA school, I retook a graduate-level chemistry and physiology course to refresh and strengthen my foundation. I wanted to be sure I could handle the academic rigor and rebuild study habits before the program starts. I also took an advanced ECG and pharmacology course through a continuing ed provider, both of which were helpful in deepening my understanding. On the clinical side, I've been working in a high-acuity surgical ICU for over 2 years. I've taken on charge nurse responsibilities, precepted new hires, and regularly care for patients on multiple vasoactive drips, ventilators, and CRRT. Outside of work, I've joined a CRNA prep group and attended webinars on anesthesia topics. All of this has kept me sharp and helped me stay focused on my goal. I know this program won't be easy, but I feel more ready with every step I take. If you want to learn more on how to land jobs and reach your career goals, don't forget to hit that subscribe and bell notification button to get new videos every single week. Also, don't forget to hit that like button because that motivates me to keep doing what I do. Stay safe, keep smiling, and good luck.